Hi, everyone. Thanks for logging on. The goal for tonight's meeting will be to learn the nominal group technique and apply that technique to the topics that we came up with in our first meeting. Then we'll go over what to expect for our next meeting in April. Our presenter tonight is one of our PCORI consultants, Dr. Peter Cronholm. Dr. Cronholm is the Associate Professor of Family Medicine and Community Health at the Hospital of the University of Pennsylvania. He is the Associate Program Director of the DFMCH Residency Program and Director of the Mixed Methods Research Lab. His research interests are in mitigating health disparities through health services, and some of his previous PCOR grant publications include engaging medically and psychosocially complex patients, engaging stakeholders and patients with complex health and social needs during a public health crisis, and implementing best practice patient-centered venous thromboembolism prevention in trauma centers. He's an expert in using and teaching the nominal group technique to increase engagement in PCOR projects. He is actively involved in several community programs and has many other accolades. Dr. Cronholm will introduce the interactive exercise using the NGT toolkit that will help us remember our brainstorming topics from our first meeting. Thank you for joining us tonight, Dr. Cronholm.
Thank you. I really appreciate that introduction. And Matt, do you want to introduce yourself real quick?
Absolutely. I'm Matt Kaerney. I also am Department of Family Medicine Community Health at Penn and work with Dr. Cronholm as Associate Director of the Mixed Methods Research Lab.
Well, so first of all, I wanted to thank you for inviting us to be part of this engagement process. So we were asked to present on a technique known as the nominal group technique, which we used in one of our engagement awards to help build consensus. We want to, our objectives are to increase everyone's familiarity with the process as a way to build consensus, and also make sure that you understand the key elements of a successful nominal group, and have a good sense after the session about what the product really should look like. And then we wanted to end the session with all of you participating in an abbreviated version of a nominal group. And we want to sort of jumpstart the process using the ideas that we generated at the last stakeholder meeting. So nominal group is a group methodology. It was developed in the 60s. As it was being developed, it was noted that participants reported really high satisfaction with the process, and that the product tended to generate larger numbers of ideas compared to other group methodologies. It's a version of a small group discussion. It is highly structured, and it's designed to lead a group towards consensus. We do this most of the time with groups of 5 to 10 people, which is going to be one of the limitations of tonight's experience. This is a big group to do this with. But, we mostly want you to sort of be part of the experience and take away what the process, what's involved in the process. So we ask individuals in the group to sort of think about and generate ideas to a question that's posed by a moderator, and then ask those same people in the group to rank those ideas. And so you end up with a product that is a prioritized list of items related to the question or topic of interest to the group. And then the actual steps of a nominal group process are pretty straightforward. So we start off with an introduction. The facilitator welcomes everybody and explains to them what the purpose and the procedure of the meeting is. Sometimes there's some icebreaker activities or things to sort of frame the question that's going to be asked. And then the moderator poses the question to the group. And then the group is asked to sort of just silently reflect on the question, think about ideas, how they might answer it. They're encouraged to write down ideas. We always give participants paper and pencil to jot these down. We don't collect the paper and pencil, so people don't have to worry about how they spell things, or if they write down things, they end up not wanting to contribute to the group. It just gives them some space to think up things on their own and in self-reflection. And then there's a process. We usually just go kind of round robin around the group and ask each person to give one idea. And people are, it's understood that you can pass at any time. If you passed before, you can always give an answer the next time it comes around to your turn. If you heard something that helped you think of an idea that you hadn't thought of before. And then this process continues until everybody has given all the ideas and everybody has passed. And we're going to sort of pretend that the last stakeholder meeting that we did together was sort of these first 2 steps, and try to use the ideas that came out of that as that list of shared ideas that the group presented. And then the process involves a discussion within the group. We want to make sure that every person in the group has a shared understanding of what each of the items that were generated from the question means. Sometimes people describe really big things, and the group sort of looks at the list and decides that something might be out of character for one, and maybe that's big enough that we ought to break it into another idea or 2. Sometimes very similar things are mentioned, and once we sort of go through the process of clarifying all of the items with the group decides that those are maybe close enough to be put together. And so this sort of cleaning process is just making sure that everybody's on the same page about what all the items mean, and that we really represent a good understanding of what this group wants to contribute to that question. And then there is a process of ranking. So everybody writes down, is asked to write down their top 3 votes for whichever of the 3 ideas on the list they think are the most important for the question asked, and then give that card to the moderator. It sometimes helps. We often have 2 people, and tonight Matt's going to do yeoman's work trying to collect all of your votes and get them put into an Excel spreadsheet incredibly quickly. But we are often doing this on a flip chart. I'll show you some pictures of that in just a minute. But we go through and indicate, usually with little tick marks, how many votes all of the items got. And then some groups decide to just stop with 1 voting. And you can walk away with after a single step, if it's taken a lot of time, if you don't have enough time to do another re-ranking, and then use that as your prioritized list. We often try to incorporate a re-ranking that happens after the first set of votes, where everybody can see the items that everyone voted for and actually see what the full votes were for everything. And then we ask people to just reconsider the list, and to, sometimes people are on the fence between 2 things, and having a sense of how other people thought about those items or valued them sometimes shifts how people make their votes. So we ask people to just submit their top 3 votes again, usually limited to the items that had received votes before, and then give those to the moderator, and then they collect those votes. And that process usually takes about 90 minutes to do. It depends on how rich the conversation is, but it does take quite a bit of time to go through that process. So the benefits of nominal groups is that they give people a chance to reflect silently on their priorities. This has a way of really preventing individuals from dominating the conversation. It's a particularly good method if topics are controversial, where debate might limit generation of items, if you were to just have like a focus group and dialogue about a topic. And one of the things that's really wonderful about the process is you walk away with a usable product that is reflective of how the group prioritized the items discussed. So I just wanted to give you a really quick overview of an engagement process we did with Lancaster General Hospital. We were looking at implementing programs related to the care of patients who have both medical and social complexity in their lives. We did NGTs to develop ranked priorities for these 6 stakeholder groups that are listed. We were asking them, we did 3 nested NGTs in single sessions with each of our stakeholder groups, where we asked them to identify and prioritize health issues, and then to describe barriers related to those health issues that made them challenging, and then also to generate some ideas of solutions for those challenges. And then after the groups, we also did individual interviews in our engagement process so that we could explore the NGT findings in depth and also to make sure nothing was missed. There could be topics that people didn't want to bring up in a group setting. And then finally, we held 2 stakeholder meetings where we sort of sequentially reviewed our process and products and made sure that we had a shared understanding of the priorities. This was just our sampling strategy that shows the nominal groups, the individual interviews, and stakeholder meetings for that engagement process. So again, we held separate NGT sessions for each of our groups. I will say you'll notice when I show you some of the products at the end here that we did hold 2 groups with patients, 2 separate groups, because we didn't have a ton of people show up to the first session. We were worried we didn't quite have enough folks to really represent patients' perspectives. And we used that process to get priorities for each group separately. And then we developed a process for trying to connect those results into a single sort of combined ranking process across all of the groups to sort of represent what we all sort of took away together. And we used a summary score to do that. And we made some data visualizations to try to help present our findings. So these were pictures from that session. I was mostly nervous I was going to lose the paper, so I took pictures of everything. But we used flip charts, and you can see the little tick marks where we indicated the votes that people got, and then took those home and moved all of that data into a spreadsheet so that we could look within the groups as well as between the groups. And I just show this example just to illustrate that the re-ranking process, there really was an effect of the second ranking. It shows how the NGT really produces, so you can see items kind of move around after the second round of votes in terms of how they're prioritized. And so just really understanding that this group process is reflective of the priorities of all the individuals in the group, but also the group as a whole has an influence on the results. And then since each group used their own language and their separate topics, we came up with a process of, we developed these summary terms to try to connect similar items across groups, and then use the rankings in each of the group and sort of added those up cumulatively across all the groups to give an overall summary score. And it produced this sort of following visualization. I will definitely start by recognizing this is a super complicated figure and it has a lot of information in it. But it shows the rankings across all of our groups. So the section at the top are the health issues. So the yellow is our health issues, the red are the barriers, and the green are the solutions. And then each of the columns represents the different stakeholder groups. So we have our patients, we have community-based organizations, we had our healthcare providers, our policymakers, healthcare executives, and then our insurance providers who are represented our 6 groups. And then this is the summary score. And all of the items are ranked by the summary score within the issues, barriers, and solution portions. And the dots represented the rankings. So the smallest dot was the 3rd ranked, the middle dot was the 2nd rank, and the big dots are the 1st ranked. And so when we walked away from this, we sort of we had a sense that we had a good amount of consensus about the health issues that people found challenging, with most of the groups recognizing mental health and diabetes as really big contributors to challenging issues. You can see that sometimes there are sort of clusters where no patients identified addiction issues as a health problem, but all of the other groups had them prioritized, if not highly prioritized. And when I looked at the barriers, I would mostly just see what my takeaway from that is that there was a lot of variation. So people gave a lot of different types of barriers that were challenges, but we got a little more consensus when we looked at solutions. And we see that all of the healthcare groups really highly prioritized integration of services, and that patients and community-based organizations tended to be more focused on mental health and behavioral health supports, as well as sort of looking at improved coverage and covering basic needs. And so, I would say that this was our group that during our stakeholder meetings. And so this was a journey towards consensus. I would say that we didn't all get to the exact same place. I think that would have been pretty challenging given how all of those groups have very different perspectives. But I do think that even with that variation, we found places to work together in defining our next steps. And the nominal group was used to gather data, but it was also a really warm way for people to present their ideas and to give each of these groups voice and to be able to really represent it, how it was similar in some cases and different in others. And so we found it to be a very valuable process. And is informing, this is just a conceptual model for a comparative effectiveness trial that is being developed out of those results that we are working to get funded. So we're going to wrap up the intro. So I'm going to put the 8 of you on the spot for this process. We're going to sort of pretend that the session we had last time, which generated a lot of ideas about what were the kind of main priority areas for the congenital heart disease community. And so I looked at it a lot of different ways. There were a lot of subtopics to some of these areas, and some of them were overlapping between the different breakout groups that came up with ideas. And we ended up deciding, mostly because of a little bit of a time limitation, to just sort of focus on the main headers as a place to start. And so I just wanted to, so these were the, I believe it's 7 topics that were mentioned as priority areas for the congenital heart disease community, and wanted to just sort of have the 7 or 8 of you reflect on those and just make sure that everybody understands what each of those means. And if any of them need any clarification, for folks to just speak up and ask. The other thing we're going to do during this process is to, if any of these seem, much bigger than the other ones, or, you think maybe are too big and maybe ought to be broken up, or if any of them seem very similar and ought to be combined, that we can also discuss that. And I would also say, it's been, gosh, has it been a month? That went really fast. It's been a while since we had our last meeting. There might be other topics that came up that aren't represented by any of these 7 things. And if that's the case, then feel free to add an additional item. So I think we have Allie, Sean, Laura, Batia, Anna, Teresa, Jessica, and Jenny. Let's see. So would any of you, do people feel comfortable with these items? Are there anything that people want clarified?
Sorry, I'm Jenny. I just had one question though, because I know you were talking about possibly even putting some of these together if there were similarities with them.
Yep.
And I noticed that with the deciding the medical treatments for the best option and the studies comparing different treatment options and choosing, were those very similar kind of to maybe where they could have been combined together?
Would any of the groups that sort of, or folks who were in those groups who described those 2 topics want to discuss a little bit about whether they thought those should be separate or whether those might be combined?
Hi, I'm Anna, and I agree with Jenny. I had that doubt too. I had the same thought that could be combined. Maybe, I don't know, maybe you wanted to separate it for a reason, but I think that we're talking about different treatments for different conditions. Those could be combined. I agree with Jenny. I thought about the same.
Okay.
Is this D and E that we're talking about? I'm sorry.
Yes.
Yes.
Okay, so that was my group last time, and we actually did talk about them in the same discussion. And I think I'm the only one on here from that group. From that, I'm trying to remember. I think I am the only one on there, and I think that it would, based on our discussion that night, I think that would be appropriate. Would be my input.
Okay. Is there
I agree.
Okay. Anybody feel like they ought to be kept separate, or? Okay. So Matt, if you, do we think one of them is a better description of what we're trying to get at. So deciding which medical treatments are the best option for a particular condition, or looking at comparing different treatment options and choosing. Any votes for which of those might be better?
So I have a question. So one category that I have been dealing with myself and I thought would be a good one to talk about would be I don't even know how to say it in a way. I'm just going to tell you what it is and you can figure out a good way to come up with it. But I'm noticing that a lot of CHD patients have other issues with internal organs besides only their heart, right? So we're all trying to kind of make sense of how CHD affects the whole entire body, not just the heart. So, for example, like liver issues, many CHDers end up having liver issues, which I didn't realize, but I'm having it myself and I didn't know it was due to CHD, or lung issues. They're all like the heart kind of controls the whole body. So they all work together. So when you say particular condition on D, I'm like, okay, is that heart condition or any condition?
Anyone from one of those groups want to speak to what they meant that represented?
Maybe we should rephrase D to say option for comorbidities or something like that to encapsulate that other statement which she's trying to represent there.
I'm sorry, would it just be basically removing the particular condition then when you're wording it? Because deciding which medical treatments are best options for a particular means you're going to focus on one, as opposed to maybe like she was trying to say, Jessica, was that there are other issues that can stem from it. So maybe just removing particular in that condition would, and reword that one.
Maybe any CHD related condition?
So the two things I'm hearing are maybe one item should be helping people decide about medical treatments for congenital heart disease. And then another item that would be understanding treatment options for other organs that might be affected by people who
I agree.
have congenital heart disease.
Yes.
Does that feel like what other people are hearing?
Yes.
Yes, I agree.
Yes.
That's what I hear. Yes.
You feel comfortable trying to sort that out with the typing, Matt?
I think I got the first one. The second one I may need help with.
Yeah. So the first one is
Help.
decide about treatments for congenital heart disease specifically. Yep. And the other one was understanding treatment options for other organs that may be affected among people who have congenital heart disease. Does that feel like it captures what we're talking about? Okay. Any of the other items unclear?
I think G, I was in the group that presented G last time, and I think what we meant was that should be broken down into like neurocognitive development, like from infancy to adulthood, and then broken down to like cognitive function decline as we get older. Because they say that CHD patients have a greater chance for cognitive decline as they age compared to the general population.
So how would other people feel about potentially breaking that one up into two different topics?
Yes.
I can see that, yeah.
Anyone voting for keeping it together?
I think breaking it down is good because neurocognitive development is like a big thing. Breaking it up into different stages is good.
Okay. So Matt, why don't we have, there you go. And then our next item in H, we'll talk about, specifically, do we want to say neurocognitive decline as a risk for patients who have congenital heart disease, or just want to say changes?
Oh, I think what you said, neurocognitive decline as a risk for people with CHDs is fine.
Okay.
Would we put as they age on there?
Yes.
And actually, infancy to adulthood is kind of as they age. Do we mean specifically as they become older adults, or does this happen earlier in life?
I guess earlier in life.
Okay.
Yeah.
Okay. Any other topics people would like some clarity on?
I had one for B. When you said transitioning from pediatric to adult care, you're solely talking about cardiac because it's congenital heart, right? So would it have to be specific on there for, are you just talking about the care in regards to physicians, solely physician care? Or is there something else that we're trying to talk about in regards to care? What kind, because I wasn't in that group. I don't know their specifics of exactly what they were trying to go for.
So if anybody was in that group, were you mostly focused on?
We were focused more on, cardiology care, going from pediatric cardiology to adult congenital physician and care teams.
So Matt, do you want to clarify that is pediatric to adult cardiovascular care or cardiology? Does that feel like that clarifies that enough for everybody? Okay.
Yes.
Anything else need clarification?
I just had a question with F, pregnancy outcomes and options for women with CHD. Are we talking only about people before surgery, after surgery, or both?
Anyone from that group?
I just wanted to ask because I was not that group. Are we including every stage?
How I view that is, and I would probably, instead of pregnancy outcomes, I might consider wording it family planning potential, maybe, because you need to consider the the options for family planning prior to even getting pregnant with as a woman with CHD. So maybe combining those things.
So how about family planning and managing pregnancy for patients with congenital heart disease?
Right, and I'm asking this because, for example, I didn't have all this information 35 years ago, and I got pregnant before my surgery, and it was like crazy. So this is information that would be very good to have all the way since you're just a little girl. But I didn't know if you were talking about the option of having a baby, but maybe after surgery. I didn't know what you were covering. But yes, I think this covers it. Thank you.
Okay. So we have our list. Any new items or other things people want to add, or people feel comfortable with this as a good representation of what we think are the highest priority topics for our community?
I just want to add on the mental health number one.
What would you want to add?
I guess when I was in that group and we were discussing the mental health, now mental health are we talking about? Because I know there's a lot of anxiety, a lot of stress. Once you're diagnosed with a congenital heart defect, I guess avenues to deal with before the treatment and avenues to deal with after the treatment, or when it comes to mental health.
Okay. So treatment options for mental health?
Right.
Okay. Could I just ask if there was also sort of recognizing mental health issues as something that's a burden in the community as well?
Yeah, I think that would be that would be a second topic.
Correct.
And people think those are different enough, they want to separate those out, or do we want a single item that says recognizing and responding to the mental health needs of the CHD community?
No, they need to be two separate ones.
Separate them.
Okay.
Yeah, because you have to recognize it before you can treat it.
Okay. So we'll add another row. Any other things need to be broken up or clarified?
Sorry, could we that was recognizing mental health.
Recognizing the mental health issues experienced in the CHD community. Okay. All right. So I think for the sake of time, why don't we say that this is our list. And then what we're going to ask everybody to do is to send Matt, and so that this is everybody, so all 19 minus 2, 17 of us, to send your vote to Matt. And it's set up so that you can only send your vote to Matt. Nobody else is going to see your vote. So this will be anonymous. So just use the letters so you don't have to type the whole thing out. So, and put a 3 next to your highest priority vote, a 2 next to your second highest priority vote, and a 1 next to your third highest priority.
Does anyone have any questions so far?
Yeah, actually, yeah. If there were any questions about the presentation or
I don't have a question, but I have a comment. I'm just sitting here fascinated, even just in realizing that if I did this like 5 years ago, I would have totally ranked things differently than I did today. Like, it's just amazing to me because now we're kind of combining everyone's perspective and where you are in this moment with your experience. So if we did it, every so often, I bet it would change even based on what you're going through.
What kind of things have changed for you that have changed how you prioritize?
Oh, I had some major experience in 2019. My valve ruptured, and so I needed unexpected open heart surgery. And that just brought to light, I guess, that I'm not as young as I've always thought I was. It felt, like you live your life not really thinking about it sometimes. And then it just, kind of smacked me in the face with it. So it's just really interesting how this process works.
I totally agree with you, Michelle. I mean, just going through the process of open heart surgery changed my perspective completely based on what I would have said before.
Any other and we kind of did this in a different way, in the sense of kind of taking these ideas from the last time. Do you think if we had started from scratch and you were kind of just given a little quiet time to think about the top priorities, do you think other things would have come up, or do you think you would have ended up in a pretty similar place?
For me, I think it's really covering everything. It's really very good covered from my point of view.
Yeah, I agree. I do like the fact, like listening to them speak, it was similar. The fact that some of these things that we're even bringing up or discussing or trying to make, bringing to light, some of these things I never really thought about at all. And now looking at them, it's like, wow, if I would have made certain things a different priority, I wonder if things would have been different. If I would have been able to find more help or more care or, resources or thinking about mental health, about any of this stuff. I never really thought that much about it. So it's interesting to see it going the way it is right now. And I'm very interested and excited to find out more about how this is going to work out for us so we can help others.
Mm-hmm. Mm-hmm. I agree.
Does anyone
So Rita and Joe V and Michelle, I'm kind of interested for you guys as stakeholders, because you were in the project from the very beginning, even more than me. But so a lot of these topics on the few interviews that I did coming into this project, like I see so many of these topics. I guess just when Dr. Cronholm asked, did we think we would have come up with different topics? My immediate response was no, because so many of these came up in the interviews of people who wanted to be a part of this research project, and the same things kept coming up over and over again. And the driving force was among all of us wanting to do this research was just that we wanted everybody to get treatment and know what we knew now. And so I'm just interested because my immediate response to that was no, I feel like this is pretty consistent. And so I'm interested with you guys who have been a part longer than me, if you feel that way, too, because that was my thought.
So why don't we sort these data, and then we're going to hand this over to your leadership group to take you through a little bit of a conversation about how you might use these priorities. So this is a good example. You have a top 3, but actually 2 of the items tied for third. So you actually have 4 items that came out of this. Now your group may decide, maybe there's not a huge difference between 11, 10, and 9. So maybe your group wants to, not lose the fact that I, C, E, and D were all pretty close. So, there are no hard and fast rules about how you use this. It's just a guidance. But I would say that the 19 and 16 do sort of stand out in terms of their rankings as sort of really top priorities from this group. And then, if we had a little more time, it would be really fascinating to kind of do this one more time and see that now that you've seen how other people in the group have thought about these issues, if it might have affected your vote. And I'm going to hand this over to our leadership group to maybe take us through a conversation about these results. Thank you, Matt, by the way.
So this was a really great exercise. It's really interesting to see what the group values as a whole as their most important priorities. So I definitely hope that we can work more with this. And like you said, maybe have another round of voting later on. And I think that will definitely give us a good direction to go in as far as shaping and developing our research questions. So thank you for teaching us this technique.